water access and management. And we have a highly resource person in this field to talk to us today in person of Dr. Kabiru. And he'll be coming up shortly. As our custom, well, once again, want to apologize for the misinformation that happened this morning. Zoom had a downtime, so we couldn't start our meeting. And a mail went out that the meeting had been postponed. We apologize for that. Okay. Hello. Somebody is asking for audio. Please, can you hear me? Please confirm if you can hear me. Through the chat box, please confirm if you can hear. There is no audio. So I think they are still not back. Okay, somebody say he can hear. Okay, thank you very much. Thank you so much. So please, if you are not hearing me, check your computer. I think a majority can hear us. Thank you very much. We just want to confirm that we are all together. Thank you so much. So we'll start with our opening prayer, the national prayer. At the count of three, we'll take the national prayer in our various positions. 1, 2, 3. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed. Thank you. Amen and amen. So the general guideline, of course, we know the ground rules for our webinar. Let's endeavor to use our chat features for comments and for questions. We may not be able to take one-on-one interaction that's allow you to speak because of time. However, we'll try as much as possible to tackle all the questions that will come. The presenter will be able to respond to that. And in case you have challenge with technical and accessibility, kindly refresh your Zoom application, your Zoom app. And then this meeting is being recorded, and just like every other webinars that we have handled, we'll share the link, the recording at the end of the meeting to all participants. The sector-wide webinar, it's actually meant to give platform to everyone in the health sector to be able to showcase what they are doing. And this morning, we are having the Department of Food and Drug Services. They are the one that is anchoring this series, this 7th series. They are the one presenting to us. So I'll be introducing our keynote presenter shortly. So he's Kabiru ABASS, and is a professional teacher, a mentor, and strategic manager with over 28 years expertise in water, sanitation, and hygiene, East Africa, United Kingdom, Bangladesh. You see, like I said, he's very ready for us because he has a wealth of knowledge that ready to give to us this morning. So his work focuses on various aspects of WASH, so that water quality and safety. He has experience in WASH assessment and capacity analysis, strengthening and building with a focus on community-based WASH facility and management and pipeline distribution. He has also worked on water quality monitoring and surveillance, early recovery, health system strengthening. He worked as a team lead for the EU-funded intervention in Borno State, focusing on health system strengthening and resilience, including WASH, sustainability in infection, protection and control in PHCs. He also has worked in establishing WASH, in training in health facilities on WASH, and also school WASH program. So he will be joining us. Okay. So he's on board of many public and private organizations. He has worked with WaterAid, EU water sector reform, UNICEF WASH Program, EU Early Recovery Health System Strengthening, UNOPS, WSSCC, WASH in School. And so shortly we'll be coming up to start its presentation, but I just remembered something that I did not introduce myself to those that doesn't know me. So I'm Bosede Arogundade, and I'm the head coordinating unit for the Department of Health Planning, Research and Statistics, Federal Ministry of Health. I'm your moderator for today, and I have on the panel my co-moderator, Mr. Okoye Boniface. We'll be anchoring today's session together. So please join me to welcome Dr. Kabiru ABASS for the presentation. You're welcome, sir.
Thank you, Madam Arogundade. Can you hear me, please?
Yes, loud and clear, sir.
Okay, let me thank everybody, starting from everyone that has made this possible. Then let me observe some little protocol. Our very hardworking and delivering outcome minister, state minister, all department heads, all other protocols observed. It's my pleasure to be here today and be part of this very important topic that is dear to my heart. How do we enhance public health outcomes through safe water, sanitation, hygiene, access, and management? Let me set the tone of this discussion. Public health outcome, what does this mean? These are measurable results that we are looking at in any health program or health intervention or health policies. What are these outcomes that will lead to improved health for all of us? What inputs are we putting into that program? What are the type of health facilities are we building? What personnel, what intervention activities are we putting in that will lead to improved health in our program? And this is public health outcomes. These outcomes can be in form of disease incidence, disease prevalence, mortality rates, quality of health, access to healthcare and utilization of healthcare products. So all these are the type of outcomes we want to look at, because it is all this that is going to lead to improved health and well-being. And one of the critical components of this input is also water, sanitation, and hygiene. In our health facilities, in our infrastructures, we need to provide safely managed water, sanitation, and hygiene. In our health facilities, we need to provide sanitation facilities and services. In our health facilities, we need to provide hand washing services, products, and activities. We need to provide soap, water, and all this. And a lot of empirical evidences have shown that if we are able to improve our health intervention with water, sanitation, and hygiene, we can improve well-being by about almost 70%. And this is why water sanitation is very important. Let me also take us to the SDG 6. SDG 6 is looking at water sanitation, hygiene practices. And if all these are integrated with all the other indicators, whether you are looking at indicators for health, indicator for education, indicator for gender equity, equality, water sanitation itself, and all other indicators, we will then be able to improve our health outcomes. So it's also important to look at that SDG. 6.1 is talking about safely managed water, 6.2 sanitation and hygiene. I will talk more about this as we progress. It's also important for us to look at effective management. What does this mean? It means that the type of infrastructure that we are providing needs to be optimally managed. Governance system in our, whether in our health, in our hospital, in our ministries, what is the governance system? What is the structure? What is the system that deliver all this? Then we also need to look at community management. Who and who have been trained or are in those communities where our water sanitation and health facilities are going to be. In terms of in our health, we have the World Health Committee. In water sanitation, we have Water Sanitation and Hygiene Committee. So all these are very important to operation and maintenance, so that we ensure that we don't just provide that water, we don't just provide that sanitation facility, we don't just provide that hygiene. We want to ensure that all these are effectively managed to ensure that they will be reliable, equitable, and sustainable. Then now, let's look at WASH public health outcomes. What are the WASH public health outcomes? In terms of all these inputs, what and what will it lead to? What and what will it result to? If we provide borehole, if we provide sanitation facilities, if we provide hand washing facilities, if we provide soap for hand washing, what will this lead to? Very critical is that it's going to lead to reduced incidence of diseases, disease incidence. For those of us in epidemiology, we talk a lot about disease incidence. We talk about epidemiology of cholera, epidemiology of diarrhea. If we want to understand this more, when we provide water sanitation and hygiene facilities, then there can be reduction in all this. You know what has been happening in most of our community when it comes to dry season and water is scarce, or rainy season where a lot of our waste are being washed into our water sources, we begin to have cholera, diarrhea, and all this. If we look at what happened in Nigeria in 2024, even this year, in Lagos, in Abuja, in many of our states, we have a lot of cases of diarrhea and even cholera. And these have been traced to the consumption of unsafe water sources. If we also provide WASH in our public health activities, there will be lower child mortality rates. Remember that all our cholera and all these other water-related diseases, all of them are the highest contributor to under 5 mortality. If we're able to do all this, then we'll also be decreasing the incidence of waterborne diseases, reduce healthcare. You know, one thing that is very important that we discuss a lot in epidemiology and health planning these days is the issue of our pocket allowance. A lot of us these days are spending a lot of money, a lot of our pocket allowances on taking care of water sanitation related diseases. But if water sanitation and hygiene facilities have been provided, then we can reduce this. Also very important, let's quickly go to our colleagues in the education sector. If we provide water sanitation and hygiene and go by our school health policy, in our school health policy, a major component there is talking about water sanitation and hygiene in health and in schools. So if we look at this, and water sanitation and hygiene is provided, then we can reduce a lot of absenteeism and increase school attendance and also school health in these areas. Also, issues around even diseases in these schools, we can reduce it. Let's look at some components or some concept that we need to understand. Before now, we are talking about access to water sanitation and hygiene services. However, the SDG 6 now is talking about what is known as safely managed water sanitation and hygiene facilities. So if you look at this breakdown that is showing on our screen now, I've tried to try to explain that a little bit. When we talk in the public health space, when we talk about safely managed water sanitation services, we are talking about protected water sources, boreholes, distribution channels. We are not talking about unprotected well. If it is unprotected and it's not improved, it's not going to provide safely managed sanitation. We are also talking about accessibility and affordability. It means that this water should be accessible. The distance, the time that people go and take it should not be too far from their homes. It's either it is completely in their homes, is brought into their dwellings, or the boreholes is not too far from them, and it is treated and community owned. Whether it's a borehole, whether it's a water skills, it's community owned. Let's look at sanitation. In terms of sanitation, these are the facilities that stop pathogen transfer. You know, in Nigeria, about more than 100 million Nigerians still do not have access to safely managed sanitation toilet facilities. And this is why a lot of our colleagues at the, and I'm sure a lot of them are here today, at the NTGS, this is why we are doing a lot with Minister of Health, Minister of Environment, Women Affairs and other ministry to ensure that we reduce the incidence of open defecation in our communities and use of unhygienic sanitation facilities. So everything that we need to do, fecal sludge management, improve toilet facilities, everything that should stop pathogen transfer, should not allow people to have contact with human feces. Then we need to protect the environment also. Otherwise, this open defecation can also go and affect or pollute our water sources. Now, let's look at this WHO and UNICEF healthcare framework. In our healthcare framework, looking at water, sanitation, and hygiene services, services have been categorized into 3 areas: basic service, limited service, and no service. And you can look at this from the perspective of water, sanitation, hygiene, waste management, environmental cleaning. So if you take, let's start simply from our public health care facilities. You can use this to assess and rank our public health care facilities, whether there's basic service there, whether it's limited service, whether it's no service. Please, you can read this table again so that we understand this better. But this is a framework that we use to assess water, sanitation, and hygiene facilities in the public health and public health services. Let's move to the next slide, please. Now, going from the background that I created, if we look at this table again, this table is trying to look at facilities where there are services or limited services. If we look at service facilities, whether in home, whether in primary health care, whether in secondary health care, whether in tertiary health care, where we do more of hand washing practices, then we will be reducing the incidence of water sanitation facilities compared to the ones that we have limited services. Where people are doing less of hand washing, effective hand washing using water and soap to wash their hands, there will be less incidence of water sanitation and hygiene. And that's why you see that such facilities will be recording less of water sanitation facilities. Improvement there is about 77% compared to where there is less hand washing practices. The same areas where people use more of sanitation or toilet facilities, they will also be reducing water sanitation related diseases. Where they do a lot of water handling practices, what is known as safe water handling practices, where people do not just collect from open river or open streams, where people collect from protected wells, protected borehole, and also distributions in their homes, there will also be less water sanitation and hygiene related diseases. On the overall, we have better improved healthy living and well-being in places where we have overall hygiene practices compared to where we don't have this. So what is this telling us simply is that where a lot of people are doing those unsafe practices, they are exposing people to water sanitation related diseases. Now, let's look at the situation in our country. What is the significance of safe water and sanitation in public health to public health improvement in Nigeria? If you look at the background that I've created, we still have inadequate access. I think what the data is showing us is about 33% of Nigerians still lack inadequate access to safe water and sanitation practices. Overall in Nigeria, current water access challenges can be related to a lot of health impact that we are having. A lot of water sanitation related diseases, a lot of under 5 mortality, a lot of contaminated food, a lot of contaminated water can be traced to inadequate access to safely managed water sanitation facilities. So about 70 million Nigerians still lack access to safe water, 114 million Nigerians to safe sanitation facilities, and these are the issues that is. So when we hear that there is outbreak of cholera, there is outbreak of diarrhea, under 5 mortality is getting high, it is because a lot of us still lack access to safely managed water sanitation facilities. Even if they have improved health, but they still have inadequate access to safely managed water sanitation facilities. If they have the best of the hospitals, but they still lack access to safely managed water sanitation facilities, all this will still happen. And these are the water sanitation related diseases: cholera, typhoid, and death of under 5 mortality. Now, all this repeated cholera can lead to a lot of things in children in under 5 mortality. It can affect malnutrition. It can also affect stunting. So inadequate access to safely managed water sanitation can contribute a lot to malnutrition, to strengthening, and on the overall outcome to under 5 mortality. And we can also look at the economic cost of waterborne diseases in health planning. In health planning and policy, this is a critical issue that we are looking at. We can quantify the economic incidence of lack of water, sanitation, and hygiene facilities. We can quantify it in our homes, in our communities, in our public health facilities. So what are we doing in the country? A lot is happening, but more can be done. So let's look at what is currently happening. The national coverage is increasing. However, we still have a lot of these our facilities that are not functional. Should we be building new facilities, or we should ensure that we improve the water sanitation facilities in those areas? All of us come from communities. You can assess this issue in your own community. How many boreholes are functional in your community? Should we be digging new boreholes in our communities, or should we be repairing and putting in place better improved operation and maintenance systems? We can look at the situation from rural communities, small town communities, urban communities. I won't bore you with this, but if you go to our national policies, you will see the description of water sanitation facilities delineation there. Then the key water sources that we have that are improved, these ones are the ones that are improved. If it is a pipe-borne water, if it's a protected well, and all that, and those ones are the ones that are improved. So if we look at public health impact of unsafe water sources, I've said a lot about this in Nigeria. These are diarrhea, these are typhoid, these are cholera. Imagine the economic consequences. What millions of nairas are we using to treating cholera, typhoid, and diarrhea? If we had provided all these facilities, this disease incidence will have reduced. You can also look at morbidity and mortality data that are linked to inadequate water sanitation facility. CDC have done a lot around this in 2023 to tell us, even during our COVID-19, look at one of the key inputs into reducing the incidence and spread of COVID-19 is also safe water sanitation and hygiene. We can also look at the economic burden of water-related diseases on our health. How do we treat? What quantity of drugs, of personnel, of doctors, nurses, and all that we need to treat all this? Then the out-of-pocket spending to treat diarrhea and cholera. In terms of policy, I will not bore you with this. There are a lot of policy and regulatory framework that have been put in place. We have the National Water Sanitation Policy, National Water Resources Policy, our own National Health Act, National Guideline for Water in Health Facility, the National School Health Policy. All these policies mentioned here have been provided. However, how much of implementation are we doing with this? Including our national guideline of on drinking water quality, NDQS, have also been provided so that we know the permissible level and not the permissible level of our water that we are taking, the sanitary level and all that and all that. But we know that there are a lot of gaps in implementation of this policy, and because of these gaps, because of the gaps in this policy, we are having a lot of challenges in the implementation and direct support from this. Even though some of these facilities and services have been provided there, however, how many states in Nigeria have fully domesticated these policies? If you look at, not many of them are fully domesticated, and because they have not fully domesticated these policies, that is why we are still having all these challenges. How many of us, school owners, secondary schools, primary schools, public schools, private schools, are implementing the national school health policy in those areas? So this is also an area that if we must improve public health outcomes, all of us must work towards improving this policy that have been put in place. Now, having said all this, we've looked at the background and all that, and the policies that need to be put in place. Let's quickly look at what approaches can we continue to do to enhance safe water access. We need to look more around infrastructure development. We need to look at what is the data saying in terms of access to safely managed water sanitation. Where are these facilities? Where are these facilities that are not functional? How do we make them functional? How do we improve functionality? This is an area of work that we must do. Also, we should forget that there are a lot of issues now around consequences of our overexploitation of water resources. In a community, we are building 10, 15 boreholes, not minding the groundwater. So we are exposing such area to a lot of climate change issues. We are not, if we are not properly managing the infrastructure of our sludge management, the fecal sludge management in our cities like Abuja, like Port Harcourt, like Lagos, how many of our fecal drainage systems are fully functional? What for communities, a lot of areas that are using septic tanks, even in Abuja, in Lagos, in Port Harcourt, and major cities in Nigeria, how many of these are safely managed to the location? If they are not safely managed, they will continue to pollute the environment, and this will have consequences. So we need to look at infrastructure development and expansion, whether we need to expand or whether we need to continue to repair the ones that have goes into dysfunction. We need to do a lot around community engaged management. We need to work with the community. We shouldn't say because we are experts, oh, I have PhD in public health, I have I'm an engineer, this, that. No, the community people too have their own indigenous knowledge. We need to involve them, particularly looking at the importance of community structures, community systems. The World Health Committee, we need to involve them. The Water, Sanitation and Hygiene Committee, we need to involve them. All these have got a lot of, even in our urban water supply, we need to put in place the water user associations and also community-led total sanitation initiatives. Then technology is also very important there. We need to look at how to deploy technology that can be managed for us. Also important is capacity building. How are we training our own people? What type of trainings are we giving to them? Then the national standard for drinking water quality. I will speak a bit about this because this is very important for us, because the Ministry of Health also have got a responsibility to ensure the national drinking water quality standard in terms of the parameters that have been put in place. All the ministries, we've discussed this in the National Task Group a lot. All the ministries have got a role to play. For our Ministry of Health, we are to set health-based target and standard, and also to monitor whatever is happening at that level. Fecal sludge management, I've said something about it. This is important. You can see in the diagram there, and that is the chain, the sanitation chain that we all must be involved to ensure that they are safe. Safe water management practices at household level, wherever we are working, this is very important. Partnerships and financing is important. We need to keep working together. We also need to keep working with our development partners, UNICEF, World Bank, EU, and all of them, to ensure that we can improve whether wash in health facilities, wash in school, and also very critical is our own primary health care under one roof. How do we ensure that we all work together, ensuring recoveries, ensuring improved well-being, nutrition, and all that? How do we do public health under one roof? Nutrition, water sanitation, maternal mortality, and all that. Very critical also for all of us is monitoring and evaluation. A father doesn't know how many children he has may not be able to provide effectively for that household. How are we monitoring those things? What indicators are we tracking? How are we tracking safely managed water, safely managed sanitation, the number of hand washing facilities? I tell us, in the Ministry of Health, in primary health care at local government level, let us do a simple survey. I challenge all of us to do this simple survey and come back with our results. How many water sanitation facility is functional in that primary health care facility? How many hand washing facility is functional? If I go and do an observation assessment, how many of our toilets in that PHC have soap for effective hand washing? How are we monitoring all this? How are we tracking this? If we are not tracking all this, then how do we track our public health outcomes? So we need to do more around data collection and real-time reporting, so that if these things are not there, if there are issues on sanitation facilities, how can we correct it? What is the level of coordination between the primary health care at that local government level, between the state primary health care agencies or board? How does that get to the national primary health care, and how does that get to the Ministry of Health in terms of our monitoring and evaluation management information system? We need to do a lot more around that, so that we can be getting real-time indicators that we need to monitor whatever is happening. So monitoring and evaluation is very important. So my people in a PRS, please, and the M&E unit and department, we need to do more. It's not bad in Nigeria, because we have some success stories in terms of what we are doing. We have a lot of projects that have been effective. We have what is known as the sector-wide approaches, rural water supply, water and sanitation sector reform program. We have a lot of success stories from this. Community-led total sanitation, even though we adopted it and adapted it from Asia, from India, Bangladesh, and all that, we've successfully implemented it in Nigeria. And I think today we have some states that have been declared ODF. State like, I think state like Katsina and Jigawa states, the entire state have been declared ODF. But we have a lot of states that are still struggling with many local government not ODF yet. And if we have a lot of these local government not ODF, then the disease outcome will still be there. WASH in healthcare facility, we also have a lot of case studies and success stories in Abuja, in Lagos, and other areas. WASH in school, we also have a lot of success stories. We have the presidential initiative, the national task group on sanitation. We have a lot of our international days. I think we need to do more around that. March 22, October 15, November 15. What are the challenges and recommendations? Let me quickly run through this. There are a lot of our identified barriers. There is still a lot of funding gaps. What is the level of budget for water, sanitation, and hygiene? How much of that is released? How much of that is utilized? We have a lot of political instability in some areas, in our northwest, in our northeast, in those areas. We also have a lot of issues around climate change in terms of how we exploit our water resources. Then, so if we look at all this, we can look at some strategic recommendation for our stakeholders. We need to increase investment into water sanitation and hygiene. We need to strengthen interagency collaboration, which we are already doing with NTGS. Then guidelines, we need to look at how to implement a lot of these, our guidelines. Some people, I did some projects in some states. A lot of people are not even aware of the guideline on washing the health facilities and all that, and our technical guidelines. Monitoring and evaluation, we need to improve all these. Our national standard for drinking water quality, some people are still not aware. We need to create a lot of public awareness around it. Climate change issues is in all of us now. We need to do more around this. Recommendation for infection protection control, we need to do more WASH assessment to identify gaps in our WASH services. Training is important. Campaign. We need to provide more infrastructure on hand washing, the hand washing facility, the soaps, and all that. Then a lot of monitoring and feedback is important. If we're able to do all this, then we will be reducing all these incidents. So we need to keep re-emphasizing the link between safe water sanitation and improved public health outcomes in Nigeria. We won't say this enough. For our medical doctors, for our WASH professionals, for all of us, health professionals, WASH professionals, we need to see this link and need to keep talking about it. It's called for action. It's a call for action for all of us, for policy makers, the people that are making the policies. How do we make it work? For development partners, we also need to do more. We also need to put more resources to where it is needed. It is not enough to just be putting the resources, but let's use our data. The data and information need to guide us to put more resources into where they are needed. Also for Ministry of Health, in our healthcare facilities, whether at PACs, at secondary, at tertiary institutions, we need to look more around our healthcare services. How do we integrate water sanitation? Then the Ministry of Health, we need to do more on this, the national standard for drinking water quality. We need to create more awareness about it. Let people know that this is important. Let people know the permissible level and the allowable level. If you are collecting water from borehole, has it been tested? What is the distance of our borehole to a toilet? All this, we need to follow the guideline and the permissible and allowable limits that have been provided in that guideline. Call for action for the Ministry of Health around climate resilient planning. Ministry of Health in our infrastructure, in our activities, in our incineration and IPC activities, in public healthcare facilities, we need to ensure that we are not allowing it to affect the environment? Where are we putting on our health waste? How are we managing health waste to ensure that it doesn't go back into our groundwater? This is an area that I think the Ministry of Health needs to look at more critically and ensure that we are climate resilient and sensitive in our planning activities in the ministry. So this is also very important. What I've done based on this conclusion is also to provide some references and some data sources where we can get some of this information that I have provided. So I thank everyone for listening, and let us take some question and answer. Thank you. Over to you, Madam Moderator.
Thank you. Thank you, sir. It's been very engaging presentation, and really thank you for such a great presentation. When an erudite scholar is speaking, they speak from their heart, not through the slides. We're struggling to follow you. Thank you so much, sir. So, please, for our dear participants, we also appreciate you for staying with us despite the challenges that we had initially. And we want to appeal that anytime we are joining, we should endeavor to put our designation beside our name so that we can give honor to whom honor is due and recognize you appropriately. So we have here with us on the call the Director, Food and Drug Department. I told us that this presentation is coming from the Department of Food and Drug Services. So I would like her to give us her remark before we go to the Q&A session. Ma'am, please. Director, ma'am. Hello, ma'am. Please unmute and give us your remark and also add to what we have heard. Thank you, ma'am. Okay, so while we are waiting for the director to give us her remark, I'll call on my colleague to take the Q&A session. Thank you. Mr. Boniface, can you unmute from your end?
Hello.
All right.
Hello. Can you hear me?
Yeah, we can hear you.
The question session, I think I'm having some issues here from my side.
Okay, that's fine. So we have just one question on the panel, the question session. He said, do we ask our facilities to provide soap? Then another person is just asking, he said, please, how can we as young students and advocates with limited resources push for change in the wash sector? I know it is multifactorial, but there are so many limitations. Please, are there tips and tricks or platforms we can be part of to advocate for WASH? Sir, you may wish to start with these two questions where we expect more questions to come in. Thank you, sir.
Okay, ma. Let me start from the second question. Very interesting.
See, I've seen yes, I've gotten it. I can.
Yes, but the presenter is speaking now. Maybe subsequent question, you can take it. Thank you.
Okay, so let me start from the second question. Thank you for this question, particularly for students and young people. I think this is an area we need to deliberately bring them in. Good enough, some of them are here today. I've invited some of them. I mentor some group of medical students, the National Association of Medical Students, and they are very keen about water, sanitation, and hygiene. We've just did a 13 weeks training for them, and they all have their capstone projects. Also in schools, in secondary and primary school, I said earlier that there are strategies, there are policies. The national school health policy is also calling attention for the establishment of water sanitation and hygiene clubs in primary and secondary schools. We need to start this, catch them young and begin to tell them about water sanitation and hygiene. So what can they do? These are children. We can use a lot of approaches in the education sector. Child to child approach, child to parent approach, child to community approach. We do this with them in school. We then ask them to go and do more in their community. On the policy area on how for them to influence policies, let me give this particular example, and we can use it in our own community. We have a community school where the water is no longer functional, where the toilet is bad, where the hand washing facilities are bad. What can we do? In such instance, we can ask these students to do a simple survey, themselves as students, whether primary school student, whether secondary school student, and do some drawings and collect data on water sanitation related diseases in that area. And then we then take them through some advocacy processes and take them to their council. Go and meet their councillor and meet their council. Go and meet their House of Assembly representative and provide and present this, that this is what is happening in their community. So children have got a role to play in all this. We can also use them as influencers, as advocates, if we let them know about the issue. We can ask them to collect data about the number of deaths, the number of diarrhea and cholera that have happened in their community, and under 5 mortality that has happened due to inadequate water sanitation and hygiene facilities, and they can present that and then begin to do follow-up. The student can go as far as also carrying placard if nothing is done after 2-3 visits to the House of Assembly. And through this, we have seen that some efforts have yielded results. Some of the students that we are mentoring, either in primary, in secondary, and in tertiary institutions, the young medical students they are all using these approaches. Or on their own, can they fix some of these things? There are some that schools can fix some of these water facilities, sanitation and hygiene. You can ask students to bring soaps. They bring soaps to school. It enables them to do effective hand washing. We have a lot of our schools these days that there are no menstrual pads for students that are already menstruating. How can we talk to our parents? How can children educate, inform, and sensitize their parents to provide them with 1 pack of menstrual pad that they can put in the school? So students, young people have got a lot of role to play. They can be advocates. They can also influence policies. What's this other question? What's the other question, please? The second question.
The question was asking if soap should be provided, if they should ask facilities to provide soap.
Okay. From the presentation today, you have seen how important soaps are. We have seen how important sanitizers are. However, if these facilities are not provided, are there other materials that have some chemical agents? Because the role of soap is to help us to kill the germs and the bacteria that is in our hand. So in some communities, a lot of researches have been done that ashes, what we get from when we do firewood, the waste from those firewood in form of ashes can also provide that. So if they cannot use soaps in the communities, they can also use ashes. But the question is this: in a lot of our public health facilities, in a lot of our schools, how many of them have soap by the side of that toilet? I challenge also all of us again to do a simple survey, do a simple assessment of the community school in your own community. How many of them have soaps? If they don't have soaps to do hand washing, then that hand washing is regarded ineffective. So it is important that schools we can appeal to PTA in schools to provide that. We can tell people coming to the health facilities to also bring their soap. But for us that are policymakers, that are implementers of all these programs, we should also budget for this. Every time we are budgeting more for water. And I tell you, sanitation and hygiene are also the greatest contributor to diarrhea. Even if we provide the water and the toilets are not good, and people still have contact with the human feces, and people are not doing effective hand washing with soap, then we will still be having those water sanitation related abilities. We will still be having those diarrhea and those cholera. Look at, for instance, during the last cholera incidents in Lagos. I was in Lagos and we were doing an assessment. We found out that some of those things were related to people not effectively washing even the fruit we eat. A lot of us buy apple and we don't wash it properly before we eat it. Or also, the ministry that is, the department that is organizing this today, what is our food handling hygiene? What is our food hygiene? The food sellers, those men and women selling those Indomie by the roadside, how much have they been sensitized for them to do effective hand washing? For our women that are doing breastfeeding, how much of effective hand washing have they done before putting those breasts into the children's mouth? For nursing mothers that are cleaning child-born bulbs, how much of effective hand washing are they doing? So this is why soap is one of the singular most important inputs in any water sanitation program that will lead to improve health outcome. Thank you.
Thank you very much, sir. The way you answer the questions shows the passion that you have for WASH, and we can see that there are quite a lot of questions for you, and I doubt if we have the time to take all of them. I'll quickly run through them, and so someone is asking, how do we ensure sustainability? Okay, Mr. Boniface, you're here, so you can take the rest of the questions from the Q&A session. I'll hand over to my colleague now. Thank you.
Sorry, maybe when he finishes, I will speak. So let him continue with the question.
Okay. Boniface, over to you.
Yes, ma'am. The next question says, thank you very much, sir. Please, how much do we ensure sustainability? Have you answered this? Have you asked this question? Okay. Thank you very much, sir. Please, how much do we ensure sustainability, sir? For those that started up WASH Club at our various communities, we concluded by donating tipping tap and soaps. However, that will not be enough. We would love to do more, but the resources, especially monetary, are quite limited, and funding sources are not really forthcoming. So the next one, what are the health impacts linked to open defecation, especially waterborne diseases? So the third one says, what is the distance between a borehole and a soak well? Thank you, sir.
Okay, thank you, sir. Let's take all these. Very good questions. Thank you for the people that have asked this question. I spoke a bit about sustainability, and you are very right. How do we ensure sustainability? Now, there are a lot of things that we can ensure sustainability. However, we should not be thinking about sustainability after facilities have been put in place. Sustainability planning should be part of the inception, conception, and planning of our water, sanitation, and hygiene facilities, whether in primary health care, whether in homes, whether in communities, whether in secondary care, whether in schools, wherever. Now, one of the things that we need to do is that whenever we are establishing these facilities, we need to carry along the people. We need to use simple technology that they can use. it is not now very wise to go and be doing motorized schemes that people will need to buy diesel to power generator to power their boreholes in Katsina, in Sokoto, in anywhere. Let's look at more sustainable approaches, more sustainable technology, solar power pumps and all that. So these are what is called the technical sustainability issues. Technical sustainability, we need to look at it. What are the low-cost technology options? What are the adaptable technology options? Then the people themselves must be involved in the processes. Who and who can be trained in the community for operation and maintenance of those facilities? So that is social sustainability. Economic sustainability is also very important. In our community, do not let deceive ourselves that water is free. Water is not free, because that water needs to be pumped, it needs to be operated, it needs to be made clean, it needs to be safely managed. For it to be safely managed, we need money to do all that. We cannot be asking Abuja to come and help us to provide. Those are the little things that we can do. The question is, that small borehole that Mr. Abbas is operating in the community as his personal borehole and selling it, why is it still functional? Why is the one for community, the community owned, not functional? So that's an area of economic sustainability. We need to, as a community, sit down to say, if somebody collects 20 liters of water, can he pay 2 naira? Can he pay 5 naira? Can he pay 20 naira? And can we be keeping this money somewhere so that whenever there is a fault, we can use that money that we've been keeping somewhere and use it to repair that borehole? This is also very important. Then, institutional sustainability. We want to appeal to our local governments, works department, water sanitation department. How are we going to be helping the community to maintain some of this facility? How can we tell them about the type of spare parts, where to buy the spare part, what is called operation and maintenance strategies? How can we help them to do such plan? So whether it's in school, whether it's in public health facilities, whether it's in a primary health care facility, whether it's in a community, whether it's in a motor park, we need to develop this community structure, what is known as Water Sanitation and Hygiene Committee, that will be responsible for the coordination, operation, and maintenance of this facility. So it's doable, and that is where we need to start the sustainability. What are the health implications? I've said a lot about this today. The health implication of not providing safely water managed sanitation is a lot of diarrhea, a lot of cholera, a lot of malnutrition, a lot of stunting. In fact, there are researches that have been done that when children are exposed to open defecation environment, there will be some. So there's a great correlation between open defecation community and stunting, and also malnutrition, and also contamination of food in such communities. So the implication is high, and at the level of outcome, what will it lead to? Under 5 mortality. We are spending a lot of our out-of-pocket allowances to do all this. So these are all the implications for not providing safely managed water sanitation and hygiene facilities. Thank you. Over. Over to you, Madam Moderator.
Thank you very much, sir. Thank you so much. I'm sure all our audiences enjoyed the highly engaging presentation today. And my own takeaway from here is that we need wash to prevent a lot of diseases. So now we'll listen to the Director of Food and Drug for his remark. Apologies for the people that posted their questions on the chat. We've actually gone beyond an hour since we started this meeting, and the meeting is meant to last for questions.
Hello, I'm the one speaking now.
Over to you, ma'am.
Good morning. Good morning, everyone. Can you hear me?
Yes, we can hear you, ma'am.
I would like to appreciate our erudite speaker, Mr. Kabiru ABASS, for doing justice to the presentation. was quite enlightening and educative. I also want to say a big thank you to all the team for putting this together. And I will want us to put more attention to issue of awareness and sensitization, our monitoring and evaluation, data collection, which are very key for us to have effective sustainability of this wash. And also, he mentioned the issue of national standard on drinking water quality. The guidelines, like was rightly mentioned during his presentation, needs for us to have a wider coverage so that we know what exactly quantity of all these metals that is needed. For instance, now, you can, all over the news now, in the issue of this Ogijo pollution now going on the issue of excess lead due to wrong use of battery producers around the area. So those are the area of enlightenment that people need to key into. And we, all the ministries, the relevant agencies, we really need to work effectively on this issue of sensitization. It's a burning issue right now, even as we are speaking in the National Assembly and most national dailies today. There is a lot going on this lead pollution in that Ogijo area in Ogun State. So there is a call for all of us to put hands on deck to ensure our water are safely managed, and that can reduce mobilities and mortalities rate in our society and the country as a whole. And the SG3 can effectively be achieved. Thank you once again, and well done, everyone. Thank you.
Thank you, Ma. Our audience didn't know the person that just spoke to them. Ma, please, can you just introduce yourself to the audience?
Okay, I'm Olufobi Yusuf Adeola, MNI, a director with the Department of Food and Drug Services, and also the head of Food, Chemical, and Phosphatic Water Safety Management of the division. Thank you.
Thank you very much, Ma. So we have quite more questions, but like I said earlier, we'll not be able to take all the questions. However, we are collating the questions together. We'll send it to the presenter to provide answers. And when we have that, we'll use the invitation link to send it to everyone that participated at the seminar. Thank you so much for joining in today. We are going to post an evaluation form for you to evaluate the seminar, the webinar, and at the same time, we want suggestions on the kind of topics you would like us to bring up in this webinar going forward. And this might be our last webinar for the year, and we wish everyone a happy holiday season, and we look forward to a better and a stronger 2026. So use the code for the attendance and for the evaluation. And on behalf of the Director, Health Planning, Research and Statistics, Dr. Camille, all the directors that joined us today, I want to appreciate you for coming. Our CEOs, these people from the state ministries of health, some of them are on the call. CMDs of our various hospitals, we want to thank you. And I also want to appeal that please, we should be changing our name to effect our institution where we are joining from, so that we can give due recognition to all participants. Thank you very much for staying with us today. We appreciate your commitment, and also appreciate the Department of Food and Drug for using this platform, allowing us to host their webinar on this platform. Thank you and have a pleasant day.